Hello, Dr. Minkoff.
Hi, Michelle.
Can you tell us about some case histories and successes that you've had with heavy metal detoxification?
Oh, sure. In fact, the first one's how I got into this business. My wife was heavy metal toxic after the incorrect removal of mercury fillings. She was an athlete, a triathlete, completely healthy, good diet, all that stuff. Took supplements, always health conscious. Weight was normal. Got her fillings removed by a dentist who didn't know what they were doing. She got poisoned with mercury. She had symptoms of MS, okay, like loss of use of a deltoid muscle on one side, loss of a glute on the other side, thyroid swelling and inflammation, elevated liver enzymes, and she was toxic with mercury, with high mercury levels. We chelated her with metal-free and EDTA, and over about a 4 or 5 month period, she got better. All her symptoms went away. By removing the heavy metals, the toxicity that was affecting her nervous system, her thyroid, and her liver disappeared and got better. That's about 14 years ago. She's completely fine now. So that's a really good example. Another example is Glenda. Can't sleep, poor mood, doesn't feel well, feeling not herself, doesn't know why not. Glenda's 59 years old. Also, little bit of a tremor. Like little bit of a tremor hand, little bit of a tremor head. Like I would sit and talk to her and like, She had gone to the neurologist. The neurologist said, oh, this isn't Parkinson's disease. This is benign essential tremor. Lord knows what that means. It's a wastebasket which the neurologist uses to say, I don't know, and I don't really care, and I don't know what to do with you, leave you alone. Well, she had high levels of arsenic and mercury, also mercury in her case. And when we detoxified heavy metals, within about 4 or 5 months, the tremor went away, the shaking went away, the mood improved, and the sleep improved. And that was by removing her heavy metals. She went relatively quickly, and she was very gratified because within a few months of taking metal-free, her tremor actually stopped. So this does actually work. If you get these things out, the body can recover and the symptoms can go away. I'm going to give you one more case. Almost all patients with autoimmune disease are heavy metal toxic. If you measure them for heavy metals, you will find it. And heavy metals seem to bind on tissues in such a way as to make the immune system think that your own tissues are not you, or they're foreign and something has to be done about them. And so what the immune system does is attack. We see this with rheumatoid arthritis or lupus, and we find that if we get the heavy metals out, that then the autoimmune reaction goes away. In fact, in many cases, the autoimmune antibodies even go away, and the person doesn't have that disease or condition anymore based on the diagnosis of a high ANA or positive rheumatoid factor or positive symptoms. And so in most of these patients that have autoimmune disease, we are looking for, among other things, heavy metals. And when we remove them, sometimes there's also several types of infections that then the person actually gets better, feels better, and their disease seems to go away. At least the symptoms aren't there. Okay?
Thank you.
Yeah.